Well, good afternoon, everyone, and welcome to the second day of the Hunter's Hope Medical Symposium. We are so glad that you are here with us this afternoon. We have another great day planned for you. Our first speakers will share their exciting research toward discovering better treatments for leukodystrophies. And then we will hear updates about several guidelines to help improve the medical care and outcomes of individuals with various leukodystrophies. Before we get going, I did want to just give a brief overview and update about our Leukodystrophy Care Network, which we call the LCN for short. From the beginning of Hunter's Hope, a primary goal of the foundation has been to create centers of excellence for patients with leukodystrophies. Around 2013, our CEO, Jackie Wagner, who is Hunter Kelly's grandmother, she really began to focus on launching this program. And she did this by researching successful models of centers of excellence in other disease groups, while also learning more about the specific needs in the leukodystrophy community. And in doing that, it really became clear that we needed to follow the model established by cystic fibrosis. When the Cystic Fibrosis Foundation began in 1955, patients with the disease were not expected to live long enough to attend elementary school. The foundation started by establishing two centers of excellence that were committed to proactive multidisciplinary medical care for patients with CF. And over time, of course, the number of centers grew tremendously. Also, through a process of establishing standards of care and then studying the outcomes and making continual improvements to those standards of care, people with CF now live to the age of 30, 40, and beyond. And this incredible progress has been made while there is still not a cure for cystic fibrosis. Similarly, there is no cure for leukodystrophies, but they are all treatable. So in 2015, the Leukodystrophy Care Network was established, and using the cystic fibrosis model, a network of medical providers and leukodystrophy families work together to determine the criteria and framework for the LCN. When Hunter Kelly was diagnosed with Krabbe disease in 1997, his parents were given no hope and no direction to help treat his extreme medical needs. And tragically, this problem still exists today for many leukodystrophy families. And this is why the LCN was started in honor of Hunter and in honor of the thousands of children and adults who also suffer from these terrible diseases. The mission of the LCN is to revolutionize the health and quality of life for every individual affected by leukodystrophies through a network of centers in the US and eventually the world that will provide the best possible medical care for leukodystrophy patients. One key component to the LCN is that it is patient-led. So the LCN steering committee members are all families affected by leukodystrophies. We feel it's very important that the LCN is built on the actual needs and experiences of families impacted by leukodystrophies. So in all that we do, the patient voice is included and elevated. Each LCN center must meet specific criteria, which you can find on the LCN section of our website. And amongst many other things, this includes a multidisciplinary team to provide comprehensive and proactive medical care. Also, each LCN center has a core team that run the center's leukodystrophy clinic. So here's an example of that, Nationwide Children's Hospital. So this includes a center director who is typically a neurologist, an associate director, and then a nurse practitioner or RN who serves as the LCN care coordinator for that center. So our nurse care coordinators are really the heart of the LCN. They serve as the navigator for each patient's care. And we do not believe that families should have to reinvent the wheel when it comes to navigating their loved one's medical care. The nurse care coordinator helps establish a plan, for each child or adult's care, and then they are also the family's point of contact. And the care coordinators also help coordinate care with the patient's local care team if the LCN center is not in that patient's hometown. So currently we have 12 LCN certified centers across the United States. One of the many requirements to become an LCN center is that these centers must have the capacity to serve as a site for clinical trials as new potential treatment options for leukodystrophies become available. And many of our centers are sites for leukodystrophy clinical trials currently underway. And you'll hear about some of these later today. I encourage you to visit the LCN Centers page on the Hunter's Hope website. There you can learn more about our centers, and on each center's page, you'll find a link to that center's recorded presentation with more information about that specific center. And you can also contact each center directly. You know, if you're a family and you want to learn more about potentially receiving care there, or, you know, as a provider to refer patients. Like with cystic fibrosis, with that model, a key aspect to the LCN is establishing standards of care for leukodystrophies, monitoring outcomes, and then improving the standards of care to continually improve the health and quality of life of individuals with a leukodystrophy. We call these standards of care clinical practice guidelines, or CPGs for short. And hopefully you will enjoy hearing from several of the CPG lead authors later today. So, you know, I think we're gonna have a great day today. This is really such an exciting time for leukodystrophies. There is so much potential right now, the potential for many new and better treatments on the horizon. We have these amazing centers of excellence with exceptional providers who are committed to offering the best possible care to leukodystrophy patients. And then, as we heard yesterday, there's so much hope right now for a growing number of leukodystrophies through newborn screening. Here's my contact information. Please do not hesitate to contact me with any questions you might have about the LCN or anything else that we talk about today.